They began their abortion-centered march toward controlling the Black birth rate by locating their centers in Black and Latino neighborhoods. In 2012, Sue Enouen took care to give us a very clear picture of their evidence-based relocation analyses that guaranteed they were in a Black or Latino neighborhood. I'm going to ask Sue to come now and just share with us how she arrived at the conclusions that she drew. Sue?
Thank you, Catherine. Good morning. I'm feeling so blessed to be here today with all of you and to share what I've learned through my research. I know that together we will make a difference. My work has proven to me beyond a shadow of a doubt that Planned Parenthood has been purposely targeting minorities for abortion, particularly African Americans. I've studied the demographics surrounding hundreds of Planned Parenthood abortion facilities, and the evidence is as clear as a bell ringing in the night. As Catherine mentioned, Margaret Sanger tried to limit the growth of the Black population in 1939 with the Negro Project. It was a plan born of eugenics and racism, which labeled Blacks as undesirables, and it guided the early development of Planned Parenthood. Once abortion became legal, Planned Parenthood placed its earliest abortion clinics in Black and Latino neighborhoods to enforce its population control mission. And so it began, and so it has continued. During more than 45 years of legalized abortion, at least 20 million Black babies have perished. That is a terrible tragedy for the Black community, and indeed for our entire country. Enough. In 2011, I spent a year analyzing the populations surrounding the 165 Planned Parenthood surgical abortion facilities that were operating in 2010. To do that, I looked at census areas called census tracts, which are similar to neighborhoods. And I recorded the minority populations for every census tract within 2 miles of each of those Planned Parenthood abortion clinics. What I found was very disturbing and confirmed what many had thought for a very long time. I was able to prove with verifiable census data that Planned Parenthood had placed 79% of its abortion facilities within a 2-mile walking distance of minority neighborhoods. My definition of a minority neighborhood was one in which the census tract minority population was either greater than 50%, which of course is a majority, or at least 50% higher than the minority percentage of the county where it was located. It also needed to be higher than the national population average, which for African Americans is 12.6, and for Latinos is 16.3%. So, for example, if the county population was 20% African American, then for a census tract to be considered a minority neighborhood, its African American population had to be at least 30%. This definition of minority neighborhoods was important because a Black neighborhood can look very different in Iowa than it does in Chicago or DC, but it still has a relatively high population of African Americans. And obviously, Planned Parenthood is noticing these neighborhoods too. The abortion giant is intentionally seeking them out, finding them, and putting abortion facilities near them. This research also showed that 62% of the time, Planned Parenthood targeted African American neighborhoods specifically. But in addition to that, I saw another very common pattern. Nearly half the time, Planned Parenthood would place its facility so that it not only had a Black neighborhood on one side, but a Latino neighborhood on the other side, both within walking distance. During this research project, I worked with Brad Mattis of Life Issues Institute and his director of Protecting Black Life, at that time, the Reverend Arnold Culbreth. Together, we were able to create an interactive Google map where you can pull up each of these targeted cities and see the Planned Parenthood location, the 2-mile radius around it, and a graphic that shows the minority populations. This interactive map can be found at protectingblacklife.com, and it exposes the clear and persistent presence of Planned Parenthood abortion facilities within walking distance of minority neighborhoods, and it's all based on census data. You have to ask, how treacherous has it been for Black communities to have Planned Parenthood lurking around the corners of their neighborhoods for so many years? To have it try to weave itself into the fabric of the neighborhood, to have presented itself as the friendly neighborhood clinic, posing as an organization that stands up for the best interests of women. But its supposed good intentions, trustworthiness, and medical integrity are all a pretense. When a woman faces the challenging situation of an unplanned pregnancy, Planned Parenthood's sales pitch has one goal: abortion. By being a constant and influential presence in Black neighborhoods, and by performing millions of abortions on Black women, Planned Parenthood bears much of the responsibility for the genocide of generations of Black babies. Sadly, there's more. In 2016, I updated my study and looked at all of Planned Parenthood's 25 abortion megacenters. Since 2004, these centers have represented its ongoing strategy to be the leading abortion provider in the country. Most of these megacenters, 22 of the 25, have been built since 2009, and they are large facilities over 10,000 square feet. When I analyzed the 2-mile radius around these megacenters, I found that a shocking 80% of them targeted Black neighborhoods, just Black neighborhoods. How can Planned Parenthood be so blatant? And 88% of these centers targeted women of color overall. This was all under the leadership of Cecil Richards and all part of her strategy. But that's not all. Let me tell you about my latest research. I've been collecting demographic data for zip codes that are within 5 miles of Planned Parenthood abortion facilities, and this is why. During the process of analyzing the census tracts, I realized that even though we limited our research to 2 miles, it was obvious that Planned Parenthood's targeting approach was not limited by that. Clearly, Planned Parenthood looked 4 to 5 miles out, which often allowed them to straddle the distance between a Black community and a Latino community. 2 miles wasn't the magic number for them, as long as they were fairly close to both neighborhoods. So I decided it would be worth looking a little farther out to understand what Planned Parenthood is really up to. I first identified the counties in the U.S. with the highest numbers of abortions, assuming that these areas are most at risk for abortion. It probably wouldn't surprise you that 4 of the top 12 counties for abortion are in New York City. This list also includes the counties of Los Angeles, Chicago, Detroit, Philadelphia, Houston, Dallas, and the Miami area. Each of these cities is one of the top 10 in the U.S. with the highest Black or Latino populations in the country. All but Detroit make that list for both minorities. In these cities, minorities make up, on average, 60% of the population. And guess what? These cities and the counties they occupy get a disproportionate amount of attention from Planned Parenthood. The U.S. has over 3,000 counties, and we're just talking about 12 of them. But in these 12 counties, there are 60 Planned Parenthood facilities. That amounts to nearly 1/10 of all of their facilities in the entire U.S. And why do you think they've put so many there? Because millions of women of color live in these counties. And the sad part is that this strategy is working, because women in these counties receive nearly 1/5 of the abortions nationwide. Also in these 12 counties, within 5 miles of a Planned Parenthood abortion facility, there are 106 zip codes that are over 50% African American, many with percentages over 80 and 90%. There are also 118 zip codes that have majority Latino populations. That's a total of at least 224 zip code areas in these counties where Planned Parenthood is targeting large minority communities for abortion. In Los Angeles County, with 7 surgical abortion facilities, 57% of the targeted zip codes have either a Black or Latino majority population. In Chicago, with 4 surgical abortion facilities, 40% of the targeted zip codes have either a Black or Latino majority population. In Brooklyn alone, Kings County, 92% of the Black population of that county is within the 5-mile targeted zip code areas. Is it any wonder that in 2009, 60% of Black babies in New York City were aborted? I could go on, but here's one last example. A new Planned Parenthood abortion facility opened in Atlanta recently. In news surrounding the opening of this new center, Planned Parenthood Southeast President and CEO Stacey Fox said that the choice of location was evidence-based, using a relocation analysis to identify strategic locations. She admitted that the patients were predominantly young women of color. Well, finally, some honesty about that. Catherine lives in Atlanta, and she can tell you that the new facility is right in the middle of the Black community, which my research confirms. Within 5 miles, more than half the zip codes are majority Black, and most of those are closest to the facility. As you can see, the evidence is overwhelming, proving that Planned Parenthood has purposely and aggressively targeted Blacks and Latinos for abortion. This helps explain why Black women receive 1/3 of the abortions when African Americans are only 1/8 of the population. The CDC also reports that Black women have 1.6 times as many pregnancies as white women, but are 5 times more likely to have an abortion in their lifetime. Abortion has been a lethal attack on the Black community, and Planned Parenthood has led the charge. Through their targeting, lies, and manipulations, Planned Parenthood has encouraged and spearheaded the population control of African Americans for over 80 years, and the genocide of Black babies for over 45 years. It has forever damaged the Black community, and that was Margaret Sanger's goal. But the story isn't over yet. Now is the time to reverse this trend, to overcome the scourge of Planned Parenthood, to speak out and to make a difference. It's time to rip the mask off Planned Parenthood, expose them, and defund them forever.